As a new mother, navigating the world of parenthood can feel like a roller coaster, filled with incredible highs and challenging lows. And when you're feeling under the weather, it can be especially overwhelming. But here's an important truth to remember. Breastfeeding while sick is not only safe, it's a powerful act of love and protection you can provide for your little one. In fact, it's one of the very best ways to safeguard your baby's health and well-being during this vulnerable time. Your breast milk isn't just food, it's a living, dynamic fluid, constantly adapting to both your body's and your baby's ever-changing needs. It's a remarkable, personalized medicine created just for your child. When you're fighting off an illness, whether it's a common cold or something else, your body kicks into high gear, producing antibodies specifically designed to combat the infection. And the amazing thing is, these antibodies are passed directly to your baby through your breast milk, offering them immediate and targeted protection. So, every single time you breastfeed while you're feeling sick, you're essentially giving your baby a custom-made immune boost, tailored to the specific threats you're both facing. Extensive research consistently demonstrates that in over 95% of cases, continuing to breastfeed during common illnesses is not only safe, but also the absolute best choice for your baby's health. It's important to understand that germs, such as those responsible for cold and flu viruses, are generally not transmitted through breast milk itself. Instead of transmitting illness, your milk actively delivers protection, arming your baby with the very defenses they need. Beyond the immunological benefits, breastfeeding also provides unparalleled comfort and security for your baby, and it delivers the perfect, easily digestible nutrition, especially crucial when both you and your little one are feeling vulnerable and out of sorts. So think of your body's incredible response as a superpower, a natural and intuitive ability to protect your child. In essence, you're creating a unique and personalized medicine, perfectly tailored to your baby's specific needs. By continuing to breastfeed, you're actively reducing your baby's risk of contracting the illness you're fighting, and even if they do get sick, you're helping them recover much faster and more effectively. Always remember, you're not just providing nourishment, you're actively strengthening and fortifying their developing immune system with every feeding. Now, let's delve deeper and explore some practical strategies for effectively managing breastfeeding, particularly when you're not feeling your absolute best. Remember, you are doing an amazing job, and you are providing your baby with everything they need. You are doing more than enough, Mama. As a new mother, it's natural to feel a wave of concern when you're under the weather. Worried about passing a cold, the flu, or even a seemingly harmless stomach bug to your precious baby? It's a common worry among breastfeeding mothers. But here's some good news. Breastfeeding is still the safest and most beneficial choice for your little one, even when you're not feeling your best. In most cases, your baby is likely already exposed to your germs and any potential illness before you even begin to show symptoms yourself. So your breast milk's powerful antibodies are actually their very best defense, offering crucial protection during this vulnerable time. Remember, respiratory viruses, like the common cold or flu, don't typically travel through breast milk itself. Instead, they primarily spread through respiratory droplets that are released into the air when you cough or sneeze. To minimize the risk of transmission, wash your hands often and thoroughly with soap and water. It's also wise to avoid coughing or sneezing directly on your baby, turning your head away when you need to cough. Most importantly, continue nursing your baby as usual. Wearing a mask while breastfeeding is optional and a personal choice, depending on your comfort level and the specific illness. But continuing to breastfeed remains the most important thing you can do to protect your baby's health. Now, when it comes to stomach bugs, your primary focus should be on staying adequately hydrated, because dehydration poses the biggest risk to maintaining a healthy milk supply. Thankfully, the viruses that cause those unpleasant stomach bugs rarely, if ever, pass directly into your breast milk. So, rest assured, it's generally considered safe to keep feeding your baby during a bout of a stomach bug. Make sure to drink plenty of water, clear broth, or even oral rehydration solutions throughout the day to replenish lost fluids. For the vast majority of everyday illnesses, remember that your breast milk acts as a source of protection, offering a shield against infection rather than being a source of infection itself. Trust your body's innate wisdom and its incredible ability. It instinctively knows how to best protect your precious child during these times. By continuing to breastfeed, you're not only nourishing your baby with essential nutrients, but you're also actively defending them with a customized blend of antibodies and immune factors. So, trust the process, and keep nurturing your little one. Mastitis can be painful, but the best thing you can do is keep breastfeeding, especially from the affected breast. Nursing helps clear blockages and speeds up healing. The milk is safe for your baby and even contains extra antibodies. If it's too painful, start on the other side and switch once your milk is flowing. Most antibiotics for mastitis are safe while breastfeeding. Your doctor will choose the right one. Take the full course of antibiotics even if you feel better. Only in rare cases, like certain serious infections or treatments, would you need to stop breastfeeding, and always under medical guidance. For nearly every infection, including mastitis, the advice is clear: keep breastfeeding for your health and your baby's. When you're sick, you may need medication, but most common over-the-counter medicines are safe while breastfeeding. For pain or fever, acetaminophen and ibuprofen are top choices. For allergies, loratadine and cetirizine are safe. For coughs, dextromethorphan is generally fine at the lowest effective dose. Most antibiotics, like amoxicillin and cephalexin, are also safe. Always check with your doctor or pharmacist before starting new medicine. Avoid decongestants with pseudoephedrine; they can lower milk supply. Be cautious with older antihistamines like diphenhydramine, which can cause drowsiness. Avoid aspirin and codeine-based medicines. Skip high-dose supplements and most herbal remedies. Here's the key: take care of yourself so you can care for your baby. Choose safe medications, rest, and keep breastfeeding. Your health matters too. Illness, fatigue, and dehydration can cause a temporary dip in milk supply, but it's usually short-lived. Keep nursing frequently. Your body makes milk based on demand. Aim for 8-12 feeds in 24 hours. Hydrate well. Drink water, broths, or electrolyte drinks so your urine stays pale yellow. Rest is essential. Ask for help, let non-essentials go, and try side-lying breastfeeding to rest while nursing. Don't stress if your supply dips for a day or two. It almost always rebounds as you recover. Extra skin-to-skin contact can help boost milk-making hormones. Trust your body's resilience. You've already done so much. Give yourself grace. You are enough, even on tough days. Your body knows how to recover. While breastfeeding through illness is usually safe, offering numerous benefits to both you and your baby, it's crucial to be aware of certain warning signs that indicate the need for medical attention. Continuing to breastfeed during a mild illness can provide your baby with valuable antibodies, strengthening their immune system. However, it's essential to know when to seek medical help, both for your well-being and the health of your little one. Recognizing these warning signs early can prevent complications and ensure timely treatment. For yourself, call your doctor if you have a high fever, over 103 degrees Fahrenheit, as this could indicate a serious infection that requires prompt medical intervention. Don't hesitate to reach out to your healthcare provider if your temperature spikes, can't keep fluids down, leading to dehydration and potentially hindering your ability to care for your baby effectively. Feel severely dehydrated, experiencing symptoms like dizziness, decreased urination, and extreme thirst. Dehydration can impact your milk supply and overall health, or have chest pain or trouble breathing. These symptoms could signal a serious respiratory issue or even a cardiac problem, demanding immediate medical attention. For mastitis, seek help if you see red streaks radiating from the affected area on your breast, a clear sign of infection, or symptoms worsen after antibiotics. This could indicate an antibiotic-resistant infection or another underlying issue that needs further evaluation. For your baby, any fever in an infant under 3 months is an emergency, as their immune systems are still developing and they are more vulnerable to serious infections. Call your pediatrician for a rectal temp of 100.4 degrees Fahrenheit or higher. A fever in a young infant requires immediate assessment by a healthcare professional. Watch for dehydration. It's crucial to monitor your baby for signs of inadequate fluid intake. Fewer than 6 wet diapers in 24 hours, a significant decrease from their usual output, is a key indicator of dehydration. Dry mouth, no tears when crying, or a sunken soft spot on their head. These are all signs that your baby needs more fluids. If your baby is very sleepy, hard to wake, and unusually lethargic, it could be a sign of a serious underlying issue. Refusing feeds, showing a lack of interest in breastfeeding or bottle feeding, or has breathing trouble, such as rapid breathing, wheezing, or struggling to breathe, seek help immediately. These symptoms can quickly escalate and require prompt medical intervention. Trust your instincts. You know your baby best. If something doesn't feel right, don't hesitate to seek professional medical advice. These guidelines are here to support you, not to cause worry. They are intended to empower you with the knowledge to make informed decisions about your and your baby's health. Act confidently when needed to ensure both of you get the care you deserve. Advocate for your needs and don't be afraid to ask questions or seek a second opinion if you have concerns. Remember, your body is designed to protect and nourish your baby even when you're sick. Breastfeeding provides unmatched immune protection, comfort, and nutrition. The warmth and closeness you share are as important as the antibodies in your milk. Care for yourself with the same kindness you give your baby. Hydrate, eat simply, rest, and accept help. Self-care is essential, not selfish. Trust your body and the powerful bond you share with your child. You are exactly the parent your baby needs. Even on hard days, you're doing a wonderful job. Your milk is a gift and a shield. You are enough, always.